Well, good morning. I'm Jeff Coleman.
And I'm Debra Pinkerton. Welcome to Morning Light.
Well, the issue of race was featured heavily in New York's mayoral general election this week. But how much should it be a part of our everyday life? Changes on the new census form have people talking. I'll ask the Morning Light panel. We can see the beauty in God's design for ethnic uniqueness while recognizing we are all in this together. We're all part of the human race, Debra.
That is right. But first, here's a preview of what's coming up later in the show. Another earthquake hit Afghanistan earlier this week. At least 27 were killed and nearly 1,000 injured. The CEO of B Team International just returned from a trip to Afghanistan, and he will share how this ministry is making a difference for the people living there.
I was getting a little bit of a preview in the green room on this conversation, and wow,
it is an amazing conversation.
Incredible, yeah. Well, the U.S. Census will be updating the way it collects information about race and ethnicity in 2030. But not everyone believes race even belongs on the form. According to a new Pew Research study, a third of Americans think race should be excluded from the census altogether. Nearly half, 46%, support the current policy of identifying and categorizing citizens by race. I always get a little question mark when I get to that spot about what I should put in and shouldn't, you know.
Yeah, I'm not quite sure either. As you mentioned, there will be some key changes to the 2030 census. Those with Middle East and North African roots will have a dedicated category. Egyptians, Iraqis, or Israelis will have to provide a little bit more information. And there will be a similar breakout for specific groups in the Asian category that will include Chinese, Filipino.
My mom is very happy about that, too. She's officially on the census
She should
now.
be.
Yeah.
Indian, Vietnamese, Korean, and also Japanese.
Yes, interesting. Yeah, we're a melting pot indeed. Well, debating race and ethnicity isn't anything new. The Pew report points out that the first census in 1790 included racial categories ranging from free white males, free white females, and slaves. Wow. Categories do change, but how the data is used by government, by researchers, or ordinary citizens is just as important as the way the questions are asked. So, how does a Christian's faith speak to racial categories? Is it possible to see the beauty in God's design for one human race and appreciate the beauty of ethnic identity? Our Morning Light panel will tackle the subject. Pastor Joe Green, Alex Kocman, and Amber Benzon here this morning to tackle a hard one. We try to find Thursday is a day for hard topics here.
You did a good job today, Jeff.
We all grew up in Sunday school with the song "Red and Yellow, Black and White, They Are Precious in His Sight." The great missionary movements taught us about cultures. Whenever missionaries come to a church, they bring food or a sample of a tribal dress or something, and you get a sense of, well, these people are incredible, and not everyone lives there the same way in the world. Now that's changing because the world is really coming here in many ways. Joe, what is a layman's, Christian's definition of how we should be looking at race in the right way, and is there a wrong way to see it?
Yeah, and that's a great question. And I do like to nuance always race versus culture. And so we have kind of promoted this idea of race, which is a social construct, as opposed to culture. We do have cultural differences that are very real. And so my understanding of the gospel is that God looks at unity in the midst of diversity, not in spite of diversity.
Explain that, unpack that a little bit.
So sometimes we want to, in order for us to reach out and to bring each other together, we want to make everybody more like us, as opposed to embracing the cultural differences in a way that allows us to learn more about people and really to communicate with them. Because if I come to you and I want to share the message of the gospel and show love, then I also have to recognize that there are cultural differences many times that we have, and me embracing your culture doesn't take away from who you are, but it also just helps us to bring each other together and helps us to learn better, because, you know, there's a lot of good things that we learn from each other's culture.
Now, Alex, you're in missions, and there's always been a debate in missions of how much the missionary should become a part of the culture. And famously, Hudson Taylor, going to China, shaves his head, wears Chinese dress, lives, acts, speaks the Chinese culture. Not everyone agrees, though, that is the way it should happen. How much of what Joe is saying in missions is impacted in this way?
Yeah, missions is interesting because some level of contextualization is needed. Contextualization meaning not that I'm going to adapt my message at all. There's one gospel for every people group. And ultimately, the ground is level at the foot of the cross. That's part of what the biblical worldview gives us. But I do need to do everything that I can do to encode that message properly in the culture where that message is going. Not only learning language, but sometimes in the case of Hudson Taylor and other missionaries like that, adopting the culture and really understanding the way that those people think.
Right.
Scripture gives us both that ethnicity is beautiful and matters, but that also that there's unity in Christ.
Okay.
That in Christ there's no Jew or Greek or barbarian or Scythian or Jew or Gentile. We have that as well. But then we also have this beautiful picture in Revelation 5:9 and 7:9 of every nation and tribe, not erased into a homogeneous soup, but maintaining their beautiful distinctiveness as well. So we can have both biblically.
If you were working for the Office of Management and Budget, which made the recommendation to change the census form and adapt it, how would you advise the people who are constructing the census form? Is it right to have ethnicity? I know every time there's always a conversation in our house about, which box, why are we checking the box? Should we be checking the box at all? Should the box even be there? Why is it important, or why shouldn't it be there?
So we adopted our 2 kids from Thailand in 2018, and we like to say that we are the best half-Thai, all-American family. Our kids' Thai ethnicity is part of who they are. It's not something that we want to erase or whitewash or not talk about. So the fact that they are U.S. citizens through and through, they love the American flag, they love everything that they have in this country, but they are still Thai. So to be able to give them that opportunity to celebrate and acknowledge who they are, what their background is, but also we don't want to put people in boxes and make them feel like that they're somehow second-class citizens, which they have never felt like in this country. But to have a census that enables us to track demographic trends and understand, as Christians, God's beautiful design. It's a way for us to talk in our family about His sovereignty and His design for our family and His design for bringing people together. I think that's a good thing.
So you're seeing these migration patterns or immigration patterns. You're not just looking at people making a decision to hop on a plane and come here and file the paperwork and wait in line. You're seeing this as God's direction of entire groups of people, and right? Is that?
We know that God is sovereign over all, and I think it's worth understanding those immigration patterns. I think it's worth looking at the reason why so many people do want to come to the United States, and to really make sure that we are living up to those founding principles that make this such an attractive place for so many people to want to start their lives.
How does the gospel inform the way that we view race or talk about race? Is there a wrong way that we can engage this that turns off, shuts down the conversation for the gospel? Is there a right way that makes it a little easier to have those conversations?
Absolutely. Throughout history, some of the mistakes that people have made is this mindset of when I go into a different culture, I need to erase their cultural differences and make them more like us. It was the Aborigines was a great demonstration of this. But when I go into a place, when I see someone different and I know they're from a different culture, I need to learn, as Alex stated, a certain amount of their culture in order to communicate. And I tell a real quick story. I was in India doing missionary work, and we were preaching outside the gospel in a Hindu village. At the end of my message, a Hindu gentleman walks up to me. He's real close. I don't understand his language. And in that region, instead of doing like this, they did like this.
Right.
So he's talking to me in a language I don't understand. He's doing a different cultural gesture. And so I started getting nervous. And I said to my host, I said, please translate what he's saying. He said he wants you to pray for him. I said, well, tell him in my culture, when people are doing this gesture and you don't understand each other, then it could be a problem. And I equate that to how we should address each other, because we should be learning cultural cultural cues from each other so that we can communicate better and value, because that's who you are. What your culture is, how you were raised is a great part of who you are as a person, and I can't erase that part and ignore it and want you to be more like me. But how can we embrace each other in a way that glorifies the gospel and unites us as it does in Revelation, in the book of Revelation, every tribe and every tongue?
I know for many who are hearing this conversation that's very intimidating. Learning about Thai culture would have been challenging, I would think, right, Amber?
Yeah, it was a wild ride. They spoke no English. We spoke no Thai.
How old?
5 and 6.
Oh,
Yeah,
wow.
so they were fully communicative. And we spent almost a month there getting to know them. We got to meet a lot of people who had been surrounding them in their lives, and it gave us deep insight into how they cut their teeth the first 5 and 6 years. But yeah, from a broader perspective, being able to understand where people are coming from, those cultural nuances, it just helps you to love them better, to understand them better, and to, I think, appreciate what God has done, bringing people together in his divine plan.
Your family is quite a picture of that. That's beautiful. Give us, in closing, a gospel vision for next door, for people who may never travel, who are intimidated by traveling, who will never go to India, but are finding themselves living to Nepali, Indian, Pakistani neighbors now, and a tendency perhaps to say, I don't know enough to engage. What is the first step in that?
Yeah, well, you guys always say check on your neighbors. And that does matter. And look, it's a legitimate conversation. How does American culture and value hold together when we're not even agreeing on the same religion, what God we're serving, we're speaking different languages? That's an important conversation. We need to know who we are. But that doesn't mean that you need to be unneighborly towards the people next door to you as well. So whatever you make of whether it's good or bad or indifferent, some of the migration trends, it is God in his sovereignty has brought that person next to you in your life. So are you praying for that person? Are you looking for doors of opportunity? Are you seeking to invite people into your home as you have the ability to do so? Get to know them, building a relationship that can sustain the weight of truth so that you can ask them, what do you believe? And then, and do you mind if I share what I believe a little bit as well?
Those conversations are generally available. They're willing to have those
and
conversations.
what is sad is most of these people are never invited into an American person's home. You might be the first person to invite that person over.
Beautiful picture. I had
food is always a good connector too.
I had a question from a Kenyan the other day who was wondering what snow feels like. Oh, wow. But even going into the winter seasonally, those differences, how exciting it
ask that too.
They do, yes. Well, thanks to our panel for joining us today. Coming up on Morning Light, B Team International is saving lives and changing communities through quality health care, training, global partnerships, and compassionate patient care in Afghanistan. Debra will sit down with the CEO up next. You're watching Morning Light right here on Lighthouse TV.
Welcome back. Pennsylvania-based B Team International works in Afghanistan to improve healthcare resources for the people living there. The CEO of B Team International, Dr. Rick Manning, is here to talk about his recent trip to Afghanistan. Thanks for being with us.
Glad to be here.
Remind us about B Team International.
Yeah. B Team works in Afghanistan with international and national partners to provide excellent health care and to train the next generation of healthcare providers. And we've done that in a variety of ways, but primarily we have 4 programs, one in obstetrics gynecology, one in general surgery, pathology, and family medicine, which is something we introduced. And so through these 2 to 3 year programs, we're training the next generation of healthcare professionals. We also do a lot of 1-month refresher courses for a lot of healthcare providers, midwives, nurses, other doctors.
So equipping people there to do everything they need to do to take care of people in Afghanistan.
Equipping Afghans to take care of Afghan people. Our staff is 100% Afghan.
So you were recently there, and Afghanistan has had a rough time. Earthquakes in September and October killing more than 1,500 people. And then just this last Monday, another earthquake. Yeah. What was it like there?
Yeah, so I mean, Afghanistan's about the size of Texas, smaller, but imagine
that's amazing.
3 earthquakes, 3 earthquakes, so the country has literally been rocked. And already they had a severe crisis in terms of shortages of resources. I was able to visit a hospital, 300-bed hospital, and talk to the obstetrics gynecology staff there. They do on average 2,500 deliveries a month, sometimes 200 in a day. So you talk about overcrowding and just a great need.
That is such a large number.
Yeah, it's a lot. It's a lot.
Wow. So how did you help out? I mean, what was your step when you were there saying, okay, things need to happen?
Yeah, so primarily I was interested in securing the base that we have. We have this nucleus that we've built up over 20 years, these doctors and this whole staff that we've worked with. Secure that base and make sure that's good and strong, because from there we work outward. And from there we also then form partnerships. And literally 2 other organizations have contacted me since the earthquakes. Your Relief, they're based in Greece, and Morningstar Development, based here in the United States. They want to partner with us to have more sustained earthquake or natural disaster relief efforts. We can provide the immediate response because our doctors are there, but then these organizations are more interested in letting that continue for the sometimes years afterwards that needs to happen.
So more people, more organizations, more nonprofits coming together to work together for the same purpose.
And it's remarkable. Nonprofits are really starting to come back into Afghanistan, and they're being welcomed. And so part of my going back was prompted by a doctor who had been there before and a nurse who wants to go there. And I had kind of been wondering when I would go back. And when these 2 called me and said, we want to go back there again, this is just a little push that I needed to go myself again.
How can we pray for the people in Afghanistan?
So security. They've had security. The big difference, and one thing I noticed, is that it was peaceful. There wasn't helicopters flying overhead. There wasn't military caravans driving. There wasn't armed guards every place you looked. If they can have continued and sustained peace, I think this will go a very, very long way.
We do need to take a break, but we do have much more we want to talk about as far as your trip to Afghanistan.
Okay.
Coming up next on Morning Light, Dr. Manning met with doctors, nurses, students, and the Taliban while in Afghanistan. He will share some of those conversations with us. Stay with us. We're back right after the break. Women are often denied the opportunity to join the workforce in Afghanistan. Some are unable to access services without a male relative. But some of these policies are changing thanks to B Team International. Joining me once again is the CEO, Dr. Rick Manning. So let's talk about another reason why you were there in Afghanistan, for conferences, women conferences. Talk to us about that.
Yeah, the first day I arrived there, we're just finishing a 2-day conference. It was celebrating midwives who are come from 6 different provinces to be made aware of fistula, how to treat it, how to refer it, how to recognize it, and it was a joyful occasion. Afterwards, we had pictures, we had ceremony where we provided them with their certificates. We had a wonderful luncheon out in a beautiful lawn. It was really a celebratory atmosphere. In contrast to that, we also had a more formal graduation ceremony for some of our graduates, 33. 18 of whom were women and 15 of whom were men in those former 4 programs I just was mentioning. And the women, because there was official government there, could not be on the main floor where things were happening. They had to be back on another level out of sight. And that was hard. It was sad for everybody. But I was really proud of my staff, because when all of the officials, and again, there was the Ministry of Economy there and Ministry of Public Health, when all of them left, and we had our own little private ceremony again. So we brought everybody down. We went back up to that same stage where we were. We gave more speeches, primarily saying, thank you. No country can solve its problems with half the workforce. No country can solve its problem if women aren't part of the solution. And I think, the women appreciated that, but it was still a painful time.
So how is that? They are not allowed to be in the same space as men?
Yeah, generally speaking, uncovered faces of women and with men is not permitted. It has to happen in a healthcare setting, though. So we've been able to work with the Taliban right from the beginning and say, look, we're half female staffed. We can't do our job if they're not here. And they can't be covered because it's not good for good healthcare infection prevention principles. And all along, each step of the way, they have said, that's fine, go ahead and do that.
Wow, that is incredible. Certainly God is working through the people there. Tell us about your meeting with the Taliban.
Yeah, so again, I had
That is shocking.
Yeah, I wasn't necessarily expecting it, but I had a chance to sit next to the Ministry of Economy and the Ministry of Public Health. In that graduation ceremony, we went to a hospital in the eastern province near Pakistan. There was a deputy minister there who was in charge of, the eastern half of the country. I had the opportunity to sit next to him. And then I had the opportunity to sit next to Mr. Hanifi, who is the Vice Prime Minister of Afghanistan, basically the third in command. And it was a very interesting meeting. We walked in, there was 5 of us, and then he and his staff of 5 walked in, and he sat down in a chair, and my staff kind of shuttled me up to the front, so I was right next to him. And we had a very open conversation. Every part of it had to be translated, so it was a very deliberate, careful conversation. And he shared with me, he said, our problem, one of them is Afghans don't trust their doctors. And I said, I got to tell you, we have the same problem in the United States.
Yes.
Some of our doctors make a living killing babies. Mm-hmm. That does not engender trust. And so I said to him at that point, I said, you and I, we share a lot of values. We can work together. I'm Catholic. I'm a Christian. And he looked at me and he said, you're welcome. Please come. Please help us. We need you. We have, by the way, other religions here. We have Sikhs. We have Hindus. So please come and help us. Don't believe all of the propaganda that you're hearing.
Oh my goodness, were you just like flabbergasted by this? And did you have any fears thinking, oh my goodness, I'm sitting right next to someone who's with the Taliban?
Yeah, I had thought and prayed about it for a long time, and I trusted my Afghan staff. I know that they know what's going on, and they wouldn't put me in a place like that. I trusted God. And I also said to myself, you have to be a witness. You can't deny your faith, no matter where you go. And so I felt like he opened the door to do that when he said doctors here don't trust their patients. It was a very natural lead-in for me. But yes, I had fears. I would be lying if I said I didn't.
How do you see God working through this ministry?
Slowly and patiently and prayerfully. Yeah.
And you're seeing differences. What types of differences are being made?
Well, I just can see, first of all, when I look at our staff, I saw B team in front of me at that conference, or that large celebration we had. I saw graduates from our programs over the past 20 years, people I hadn't seen for some long time because they had graduated. It was like a B team reunion for me, seeing surgeons I had trained. One surgeon I trained, and we introduced laparoscopic surgery in the country. That surgeon he was there, and he is now introducing laparoscopic surgery in lots of other hospitals in Afghanistan. So seeing that second generation, that second wave of doctors having an impact in the system was very rewarding.
So this certainly was a fruitful trip for you.
It absolutely was.
Thank you so much for being with us.
My pleasure to be here.
For more information on B Team International, or if you would like to donate to earthquake relief in Afghanistan, check out bteamintl.org. Stay with us. We are back right after the break. Welcome back. Coming up tomorrow on Morning Light, November is National Pancreatic Cancer Month. A Pennsylvania man shares his journey with the disease and how his faith is helping him every step of the way. Plus, we first introduced you to Ryan Baumberger in September when he spoke at the Pennsylvania March for Life rally. He will share his journey with prostate cancer and how this health battle helped him become the healthiest version of himself. And that's a look at what's coming up tomorrow on Morning Light. Now, Jeff, your closing thoughts.
I got to tell you that the conversation with Dr. Manning was powerful today. Just so much to glean from that. Well, 2 days ago, a UPS cargo jet took off from Louisville's Muhammad Ali International Airport. You've seen it. Seconds later, the plane fell from the sky in a ball of fire, killing 12, including, tragically, a child, and then injuring at least 15 more. Investigators say the plane's left engine detached after flames erupted from the left wing. The official cause could take months, even years, to uncover. Tragedies like this send our minds scrambling. In English, we even have a word for it: senseless. It defies human comprehension. You know, some of us are experiencing something today which tests our idea of God. Whether God sees us or listens to prayer, and if he listens and hears those prayers, does he even care? It's in moments like these when faith fills in the gaps that common sense cannot. It's when we trust the author of our lives to whisper every second reminders that nothing is ever out of his control, that even in the worst tragedy, that tragedy is loaded with purpose. These hard moments, these hard headlines are never random. They are never wasted. Our life every day is evidence of this reality, of this truth. For Debra and the entire Morning Light team, I'm Jeff Kocman. Thanks for watching today. Now go check on your neighbors, and then let's meet back here tomorrow morning.